So I'm a big believer in, surgery is the last option for a lot of people, and we always try the less invasive things first. This goes through that list. Regular exercise has been proven not just to make joints feel better, but to make them last longer. And a lot of people have heard of the runner's high that runners get when they run, and that relates to what we call adrenaline or epinephrine that's in your bloodstream. Similarly, people that are in pain and are getting regular exercise, you get this benefit of being protected from some of the pain that you would normally have by the adrenaline or epinephrine that's in your bloodstream. So simple regular bike riding or swimming can be a very good option for people that are arthritic. Weight loss. This is underrated. I tell people, if you take off 5 pounds of weight, when you're trying to go up or down the stairs, the stress on your arthritic hip or knee is about 20 to 30 pounds of stress. And even a little bit of weight loss can make a big difference in how people feel, and that should be considered when we're dealing with this. Medications, for the pharmacist in the room and others, there are a bunch of different options. We are in this office offering a new test which tries to hone in on genetically which medicines, Tylenol, ibuprofen, anti-inflammatories, which are the safest and maybe best for you. There's also a newer class of medicine called Cymbalta, which is proven to have benefit in arthritic patients. Bracing, you can buy a brace at the drugstore or sporting goods store, but there are also for knees custom braces that can be used to take stress off of the worn out portion of the knee. These are lightweight and for most patients easy to use now. That's an option for knees. Physical therapy, as mentioned, if we have an acute attack of an arthritic knee or even somebody that's suffering for a long time, sometimes we do what are called joint-specific exercises, and that can be a good benefit seen from an easy treatment. Injections. We get 3 main classes of injections that we have to offer our patients that are arthritic. Cortisone, when we use it just from time to time, once or twice a year, can be very helpful and very effective. We don't like giving a lot of cortisone shots because too many can be damaging for whatever remaining cartilage there is left in the joint and also for the tendons and the other areas around the joint. Besides cortisone, there's a group of medications as injectables that are called sodium hyaluronate injections. Some people have heard of Synvisc or Orthovisc or Euflexa. There are a bunch of these that have been around for many years, and roughly about 70% of patients in knees, much less so in hips, benefit for 6 to 12 months consistently from getting that type of injection. Newer on the horizon, and we are proud to offer this here at Restore, is what's called stem cells, or the poor man's platelet-rich plasma, which is where we draw your blood and we spin it in a centrifuge and we inject into the joint the platelets, which have healing potential and reduce the inflammatory process in the joint. These are thought to be very helpful, particularly for people that have less arthritic joints. And then that pretty much completes the list of what we have to offer without surgery.